So I had a really interesting case yesterday, rheumatoid arthritis case that was referred by another podiatrist to see if any mobilisation or FMT would be of assistance. So Lynn's x-rays are here. I don't reckon I've seen the amount of tailor-navicular degeneration to the degree that these x-rays showed up. Literally would say phase 3 degenerative joint disease, and at phase 3 there's really, the joints are so fused there's no mobility, no movement there. It's literally bone on bone. If you look closely at the joints, you'll see the amount of erosion that's taken place is shocking. So the plan of attack is we've embarked on a mobilisation course, but with rheumatoid arthritis, there's probably a 50% chance that we're going to cause a reaction or cause a flare-up of the rheumatoid. So the way the consultation went is I outlined to Lynn. So it's 50% of our clients get some great noticeable improvement, 50% of them flare up and react, and we've just got to stop it right there and then. So yesterday afternoon I went through the x-ray results and provided the first FMT session. Also, the important thing here is to not do any manipulative techniques, and you've really got to get to know how this body is responding and what it's actually going to be able to tolerate. So we went through just the mobilisation techniques and literally worked the joints that could move. So the tailor-navicular joint wouldn't move, and a couple of the intercuneiform joints, they were also somewhat fused. So worked all the surrounding joints. So that was around 2:30 in the afternoon. After our session was finished, I gave Lynn a call that evening, so it was about 6:30 last night, and her observations were that she could feel her feet more, and probably more awareness, not so much relief or aggravation. If there is going to be a flare-up or a reaction, it's typically within the first 24 hours. And often, if it's going to happen, it'll happen very soon after. All of our clients who have their first FMT session, it's our policy to ring them that evening, because the reactions can vary, and probably 1 in 10 or 1 in 15 people get a reaction that they're not too sure whether this is supposed to happen. So giving them a call and being able to mediate to those type of reactions, real important, really worthwhile thing to do as far as your patient care or your client care. So good news was Lynn, the body had responded in a way that was absolutely tolerable. She was able to do all her normal activities, and straight away my optimism that she's going to be in the 50% that get some positive benefit as a result of the FMT, and that we don't aggravate or irritate the rheumatoid arthritis, looking pretty good. So anyway, I'll keep you posted on that, but just wanted to let you know that rheumatoid arthritis, great when it responds well, but you've got to be careful about those reactions that flare up, because if that happens, you've got to stop, time out right there. Don't persist. Until next time, keep saving souls. Cheers.